Hey guys, tonight we're stepping back into a time when a simple cough could be a death sentence, and a doctor's visit was more terrifying than the disease itself. Imagine yourself in the heart of the 18th century. The air is thick with the smell of unwashed bodies, smoke from 1,000 hearths, and something else, a sickly sweet, cloying odor that promises sickness and death. You're walking on cobblestone streets slick with refuse, and every shadow seems to hold a new kind of dread. Now let's be real for a moment. You, with your modern sensibilities and your immune system, coddled by vaccines and antibiotics, would not survive a week in this world. The simplest infection, the mildest fever would take you down. So before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. Let me know where you're listening from and what time it is for you. Now dim the lights, maybe turn on a fan for that soft background hum, and let's ease into tonight's journey together. You're a doctor, but not the kind you know. You wear a long, waxed canvas coat, not for style, but as a practical and ultimately futile barrier against the filth of the world. Your boots are heavy, plodding along the mud-slicked streets of a city in the grip of a plague. The year is 1720, and the Great Plague of Marseille is ravaging the population. It's a terrifying thing to witness a silent predator that stalks the narrow alleys and bustling markets, striking down the rich and poor alike. The air is so heavy you can almost taste the fear. But you are a doctor, and you have a duty. Your most distinctive feature is your mask, a grotesque beaked affair filled with aromatic herbs like lavender, mint, and cloves. This, you believe, is your shield. You've been taught that disease spreads through miasmas, bad air, and the sweet-smelling herbs will purify the air you breathe, protecting you from the pestilence. Of course, modern medicine knows this is completely wrong. We know now that the plague is caused by the Yersinia pestis bacterium, spread by fleas on rats. But you don't know that. You are a product of your time, a man of science, as science is understood in the 18th century. Your first patient of the day is a young woman, her face pale and drawn, her body racked with fever. She lies on a straw mattress in a small, stuffy room. The stench of sickness is overpowering even through your mask. Her family watches you with a mixture of desperate hope and resigned despair. You check her pulse, a weak and thready thing that feels like a fluttering bird. You notice the telltale buboes, swollen lymph nodes in her armpit and groin the size of eggs. The plague, without a doubt. What do you do? Your medical training is limited based on centuries-old ideas from ancient Greece and Rome. You believe in the theory of the four humors: blood phlegm, yellow bile, and black bile. You believe that sickness is a result of an imbalance of these humors. The fever, you reason, is an excess of blood, a dangerous heat that needs to be released. The cure, bloodletting? You take out your lancet, a small sharp blade, and make a careful incision in a vein in her arm. A trickle of dark, thick blood wells up and you collect it in a basin. It's a gruesome sight, but you believe you are saving her life, releasing the toxic humor that is poisoning her. The family watches with a kind of grim fascination. This is a common historical fact, the widespread use of bloodletting for almost any ailment from fevers to headaches. But does it work? Of course not. In fact, it often weakens the patient, further leaving them more susceptible to infection. The practice of bloodletting would persist for centuries, a testament to the power of tradition over empirical evidence. You move on to your next patient, a man with a severe cough. He's pale and sweating, his lungs rattling with every breath. You listen to his chest, placing your ear directly on his skin, a practice that, from a modern perspective, is a terrifying way to spread germs. You diagnose a phlegmatic imbalance, an excess of phlegm. Your prescribed treatment is a concoction of herbs and minerals. You instruct the family to give him a mixture of ground pearls and a pinch of arsenic. Ground pearls, a common ingredient in apothecary remedies, were believed to have medicinal properties to strengthen the heart and purify the blood. Arsenic, a deadly poison, was used in small doses as a tonic. It was a bizarre, often deadly combination of ingredients. The man's family, desperate, will likely administer the concoction, not knowing they might be hastening his end. The apothecary who sells this stuff is a shadowy figure, often a barber surgeon with a shop full of jars and bottles filled with strange and exotic ingredients, from dried lizard scales to powdered mummy. It's a world where the line between medicine and magic is blurred, and a trusted remedy might just be a placebo, or worse, a poison. Later, you find yourself at the home of a wealthy merchant, a man with a bloated stomach and a terrible case of gout. He's a well-fed man accustomed to rich foods and fine wines. You examine his swollen, red big toe. This is a common ailment among the wealthy, a painful inflammation of the joints. What's your solution? You advise him to apply a poultice of pigeon dung and vinegar to the affected area. Yes, you heard that right. Pigeon dung. This might seem utterly insane to you, but the belief was that the heat and caustic nature of the dung would draw out the bad humors. This is a good example of the strange little-known details of 18th century medicine. It's a grimly amusing thought, isn't it? A rich man accustomed to luxury getting a pigeon poo foot wrap from a doctor with a bird mask? The indignity of it. The day wears on a repetitive cycle of diagnosing bloodletting and prescribing dubious remedies. You visit a child with a high fever. You try to cool him down with a cold compress soaked in wine, a treatment that could be more harmful than helpful as the alcohol could be absorbed through the skin. You see an elderly woman with cataracts, her vision failing. You have no cure for her, only a hope that a traveling barber surgeon might one day be able to couch her lens, a brutal procedure that involved pushing the lens back into the eye with a needle. You try to cheer her up, but your words feel hollow. You're a man of your time, and your medical knowledge is a double-edged sword. You can help some, but you are helpless against so much. You feel the constant heavy weight of your inadequacy. The truth is, most people who survived an illness did so not because of your treatments, but in spite of them. Their own bodies, their own immune systems fought the battle and won. Your final call of the day takes you to a crowded tenement, a place where families are crammed together in single rooms. A young man lies on a cot, his body covered in lesions. He's suffering from smallpox. This is a common and terrifying disease, a scourge that leaves its victims scarred for life if it doesn't kill them outright. You've seen this many times. You know there is little you can do. The fever will run its course and either he will survive or he won't. You can only offer comfort. But even here in the face of certain death, you have a theory. You believe that the disease is caused by an excess of hot and dry humors. You recommend keeping the room as hot as possible, piling blankets on him, and keeping the windows sealed. This, you believe, will cook the disease out of him. Of course, we know now that keeping a smallpox patient cool and hydrated is the correct course of action. This misguided belief that heat could cure a fever likely contributed to many deaths. It's a grimly ironic thought, a well-meaning doctor doing everything he believes is right, but in fact making his patient's condition worse. It's an exhausting, emotionally draining existence. You walk home in the fading light, your boots heavy, your spirit weary. The miasma theory is a historical fact, but modern historians still debate whether plague doctors with their beaked masks and strange remedies were more effective at providing comfort than actual cures. It's a fascinating question, a testament to the gap between belief and reality. You are a part of that reality. You believe you are a healer, a protector, but in truth, you are often a witness to a terrifying, deadly world. The sun sets, casting long, dark shadows on the streets. You are one man armed with a lancet and a bag of strange herbs against an invisible, all-consuming enemy. You have done all you can, but you know in your heart that it is not enough. You go to bed, your mind filled with the faces of the sick, and you pray that tomorrow will be a better day. But it probably won't be. You wake up the phantom smell of sickness still clinging to your senses. The air is cool and damp, and you can hear the distant clang of the blacksmith's hammer. Your work isn't done, and today your path leads you to the cold, stark world of the 18th century operating theater. You are not a surgeon in the modern sense. You are what they call a barber surgeon, a man whose skills range from giving a haircut to pulling a tooth to, in the most dire of circumstances, amputating a limb. The line between these professions is blurry, and for many, the barber surgeon is the closest thing they will ever see to a doctor. This is a common historical fact, the combining of these two seemingly disparate trades. Barber surgeons were often considered a lower class of medical practitioner, a far cry from the university-trained physicians who dealt with internal maladies through humors and purges. But when it came to the gruesome business of cutting into a body, they were the ones called upon. Your first appointment is at a public hospital, a place that to your modern eyes would look more like a dungeon than a place of healing. The wards are crowded beds packed in so tightly that a nurse can barely walk between them. The air is thick with the smell of unwashed linens, old blood, and despair. A young man, a sailor who fell from a mast, has a leg that is crushed beyond repair. It is a compound fracture, the bone shattered and protruding through the skin, a festering, gangrenous mess. There is no other option. Amputation is the only way to save his life. You are a surgeon, and this is your craft. You prepare your tools, a bone saw, a set of knives, and some clamps. They are not sterile. Sterilization is a concept that won't be invented for another century and a half. The saw you use on this man may have been used on a dozen others, and it will be used on a dozen more after him. This is a horrifying detail, the lack of understanding about germs that is a constant invisible threat in this world. The very tools meant to heal are often the instruments of infection. The patient is given a shot of liquor to dull the pain, but it does little to prepare him for what is to come. There is no anesthesia, not in the way we know it. He is held down by 4 strong men, his terrified cries echoing in the chamber. You begin your work cutting through skin and muscle with a swift, decisive motion. The patient's screams are a gut-wrenching sound that you have learned to tune out. You work quickly as speed is considered a virtue in this era. The faster you can complete the amputation, the less the patient suffers from the shock of the procedure. You saw through the bone with a gruesome, grating sound. It's a barbaric process, but you believe you are doing your best. Finally, the limb is severed. You apply a heated cauterizing iron to the stump to stop the bleeding, a searing, agonizing act that fills the room with the smell of burning flesh. The patient mercifully passes out from the pain. His chances of survival are not good. Infection sepsis is a near certainty. He may live for a few days, a few weeks before a fever takes hold, and his body is consumed by the poison of his own blood. After the amputation, you move on to a patient with a terrible headache. This is a common complaint, a pain so severe that it is believed to be caused by evil spirits trapped in the skull. Your solution. Trepanation. You take out a hand drill, a small circular saw-like instrument. The patient is awake, held down again by strong men. You begin to drill a small hole in his skull, a chillingly precise but terrifyingly primitive procedure. The idea is to release the evil spirits or the bad humors that are causing the pain. It is an ancient practice dating back to prehistory, but it is still performed in the 18th century. It is a little-known fact that some patients actually survived this brutal surgery, but many more died either from the initial trauma or from the inevitable infection that followed. The patient's head is wrapped in a dirty linen cloth, and you leave him to his fate. You are a surgeon, but you are also a dealer in chances, and the odds are never in your favor. You're called to a private home to perform a lithotomy, the removal of a bladder stone. This is another common and excruciating procedure. The patient, a wealthy gentleman, is suffering from a condition that leaves him in constant agony. You position him on his back, his legs bent and held open. You insert a metal instrument into his bladder to locate the stone, and then using a long, sharp knife, you make an incision in his perineum between the anus and the scrotum. You dig for the stone, a gruesome, bloody process that relies more on brute force than on delicate surgical skill. You finally pull out the jagged, calcified stone, a small, hard rock that has been causing immense pain. You have successfully completed the procedure. The gentleman is in agony, but he is alive. The wound is packed with a rag, and you leave him to recover, hoping that infection doesn't set in. The chances are still against him. The fact that the barber surgeon was entrusted with such a delicate and dangerous operation is a testament to the limited medical options of the time. Your final patient of the day is a young child who has fallen and broken his arm. The bone is visibly out of place. You are a bone setter as well as a barber surgeon. You grab the child's arm, and without any pain management, you pull on it with all your might, a brutal and violent act of resetting the bone. The child screams a high-pitched sound of pure terror. The family watches, their faces a mix of pity and fear. You finally hear the sickening thunk of the bone snapping back into place. You wrap the arm in a splint made of wood and leather, and tell the family to keep it still. You've done your job. The child will likely have a crooked, misshapen arm, but it is better than nothing. The methods are crude, but they are all you have. The difference between a good bone setter and a bad one is the difference between a broken arm that heals and one that becomes a useless, painful stump. You walk home in the evening, your hands still smelling of blood and metal. You are a man of your trade, a master of the physical, gruesome side of medicine. You have saved lives today, but you have also inflicted immense pain. You have no doubt that many of your patients will not survive. You are not a callous man. You are a man hardened by the realities of your profession. You believe in what you do, but you are constantly haunted by the knowledge that your best efforts are often not enough. You wonder in the back of your mind if there is a better way. Historians still debate the effectiveness of 18th century surgery. Was it a necessary evil, or did it cause more harm than good? This is an academic argument that you, a man with blood on his hands, have no time for. You have a new set of instruments to prepare for tomorrow, and the endless stream of the sick and injured will not wait. You go to bed, your mind replaying the day's brutal surgeries, and you pray that tomorrow the wounds will not fester. The smell of blood and sickness still lingers, a ghost of yesterday's horrors. But today, your world shifts slightly. The saw and the cauterizing iron are put away, replaced by a pair of crude pliers and a menacing-looking key. Your title is still barber surgeon, but your specialty for the moment is dentistry, 18th century style. You are on the move again, walking the same filthy streets, but your destination is the home of a wealthy woman. She has been suffering from a terrible toothache for weeks, a persistent gnawing pain that has robbed her of sleep and appetite. This is a common historical fact. Dental hygiene was a concept that was almost non-existent, and a rotting tooth was a ubiquitous source of misery. The wealthy with their diets of sugar and refined bread often had worse teeth than the poor. You arrive at her opulent home, a place of fine silks and polished wood that feels a world away from the grimy hospital ward. The woman is seated in a chair, clutching a cloth to her cheek, her face swollen and pale. She is terrified, but the pain is so immense that she is willing to endure anything for relief. You examine her mouth with a small wooden stick. The tooth is black, the gum around it a swollen, angry red. You decide that the tooth must come out. There is no other option. You have no anesthesia, no Novocaine, nothing to numb the pain. You have a bottle of brandy, but she is already a-tremble with fear, and you know it will do little to dull the agony. You take out your tool, a dental key. It looks like a medieval torture device, a long metal shaft with a claw at the end. You attach the claw to the offending tooth, and with a terrible grinding twist you pull. The woman's scream is a sharp, piercing sound that you have heard 100 times before. You feel the root give way, and with a final gruesome tug, the tooth comes free, a bloody, jagged mess. She sobs, her mouth gushing blood, but the pain is gone. For a moment, there is only relief. You pack the wound with a wad of cotton, and you are paid handsomely for your brutal work. You have performed a common procedure, a horrifying little-known fact that this was the standard of care for a toothache for centuries. But your work is not always about removal. Sometimes you are called upon to replace what has been lost. You are a dentist after all, and you have a variety of materials at your disposal. You visit a man who has lost a front tooth in a tavern brawl. He is a gentleman of some standing, and he cannot be seen with a gap in his smile. You have a solution. You will create a new tooth for him. The options are limited. You could use a tooth pulled from a cadaver, or more commonly a tooth from a poor person who is willing to sell it. This is a grimly fascinating detail, the market for human teeth. You could also use a tooth carved from bone or ivory. You decide on an ivory tooth, a common choice among the wealthy. You have to carve it carefully, shaping it to fit the gap, and then you attach it to the neighboring teeth with a piece of gold wire. It is a crude and temporary solution, but for a short time the man will have a smile. The ivory will stain and the wire will eventually loosen, but for a few months he will be able to face the world with his dignity intact. You are also a purveyor of strange and often dangerous remedies. You sell a variety of toothpastes and powders, some of which are more effective than others. You sell a powder made of burnt alum and chalk, a relatively benign mixture that might help to clean the teeth a little. But you also sell a powder made of ground cuttlefish bone and a small amount of sulfuric acid. This you believe will whiten the teeth, and it does, but at the cost of destroying the enamel. You are a purveyor of quackery as much as you are a medical professional. The line is so blurry, so indistinct that you don't even see it. You believe in the remedies you sell, and your customers believe in them as well. The power of belief is a strong force in this world. Your final appointment of the day is a child with a toothache. The child is terrified, and the parents are desperate. You examine the tooth and see that it is not a rotten tooth, but a new one trying to push its way through the gum. It is a simple case of teething, a common occurrence. But the parents are convinced it is something more sinister. They want you to extract the tooth. You try to explain that it is a natural process, that the tooth will come in on its own, but they are insistent. They have heard a rumor that a child who is teething is at risk of falling ill, that the pain is a sign of a deeper malady. This is a good example of an academic debate that historians still argue about. Were 18th century parents more fearful of the natural process of teething? Or was it a genuine medical concern that has since been forgotten? You are a doctor, and you have a choice. You can follow your own instincts, or you can give in to the fears of the parents. You choose the former. You gently reassure them that the child will be fine, and you give them a bottle of laudanum, an opium-based painkiller, to help the child sleep. You know that it is a dangerous substance, but in small doses it can be a godsend. You walk home in the twilight, the sounds of the city fading into a gentle hum. You have pulled a tooth, created a new one, and perhaps even calmed a set of fearful parents. You are a strange combination of trades, a man who can cut hair with one hand and pull a tooth with the other. You are a barber surgeon, a purveyor of crude dentistry and dubious remedies. You are a part of a world where medicine is a brutal, dangerous, and often terrifying business. You go to bed, your mind filled with the memory of a woman's scream and the taste of blood, and you pray that tomorrow will be a little less painful. The sound of a dental key wrenching a tooth is replaced by a different kind of noise, a rhythmic shoveling in the dark. Your world has grown colder, darker, and infinitely more secretive. You are no longer a doctor or a barber surgeon. Tonight you are an anatomy student, and your education depends on a grisly trade. The year is 1752, and the demand for cadavers for anatomical study is at an all-time high. Surgeons and medical students need to understand the human body, its muscles, its organs, its intricate web of nerves and vessels. But there is a problem: the law. The only bodies legally available for dissection are those of executed criminals. A common historical fact: this scarcity created a gruesome and clandestine industry. The supply is far too small to meet the growing needs of medical schools. And so a new profession, a new kind of criminal is born: the body snatcher, or resurrection man. You are a young man, a student with a keen mind but an empty purse. You have paid for your tuition, but the cost of a cadaver is prohibitive. And so you have joined a team of resurrection men. Your mentor is a grizzled, cynical man named Finn, who has been in the trade for years. You meet him in a shadowy alley near the university, the air thick with the smell of stale beer and desperation. You are nervous, your heart thumping a frantic rhythm against your ribs. This is a crime, a violation of the sanctity of the grave, and you know it. But you also know that your education depends on it. You need to see the human body to cut into it, to understand its secrets. You need to learn anatomy. Without a body, you are just a theorist, a man who reads books but can never truly heal. Tonight's target is a fresh grave in a quiet rural cemetery just outside the city. A wealthy merchant, a man who died of natural causes, was buried just yesterday. He is not a criminal, and his body is therefore by law off limits. You and Finn make your way to the cemetery, under the cover of a moonless night, your boots silent on the dew-kissed grass. The air is cold and still, and the only sound is the chirping of crickets. You are carrying a shovel, a canvas sack, and a small collapsible ladder. This is a little-known fact: body snatchers rarely dug up the entire coffin. That was too noisy and time-consuming. Instead, they would dig a hole at the head of the grave, pry open the coffin lid, and pull the body out with a rope. It was a macabre but efficient process. You reach the grave a fresh mound of earth with a simple wooden cross. Finn takes out a shovel and begins to dig, his movements practiced and quiet. You stand watch, your eyes scanning the darkness, your ears straining for any sound. Every rustle of leaves, every distant dog's bark sends a jolt of adrenaline through you. The fear is a cold, hard knot in your stomach. Finally, Finn hits wood. He uses a pry bar to crack open the lid of the coffin. The smell of fresh earth and something else, a sickly sweet, almost floral scent wafts up. It's the smell of death, and it's a smell you will never forget. With a rope and a lot of grunting, you and Finn pull the body out of the coffin. It is a terrifying sight. A man who was alive just a few days ago, now a lifeless sack of bones and flesh. You stuff the body into the canvas sack and carry it back to the city. The weight of the man and the weight of your crime pressing down on you. You sneak back into the city, your heart pounding with every step. You leave the body at a prearranged drop-off point near the university, and you are paid a small sum for your part in the crime. You have a cadaver, and you have your lesson. The feeling is a mixture of disgust, fear, and a strange kind of triumph. You have done something terrible, but you have done it for the sake of science. The next day, you are in the anatomy theater, a large tiered room with a central dissecting table. The smell is overpowering, a mixture of formaldehyde and decay. The professor, a famous surgeon, stands over the cadaver, his knife poised. The other students watch, their faces a mixture of fascination and revulsion. The professor begins his lecture, his voice calm and methodical as he cuts into the body. He is teaching you about the circulatory system, the path of the arteries and veins. You are seeing it for the first time, not in a drawing, but in a real body. It is a powerful, humbling, and horrifying experience. You are a student, a man of science, but you are also a man who has profited from a grave crime. This is a good example of an academic debate that historians still argue about. Did the practice of body snatching, a morally repugnant crime, ultimately benefit society by advancing medical knowledge? Or did it create a dangerous black market that devalued human life? It's a difficult question, a question without an easy answer. You, a student with a scalpel in your hand, and the memory of a moonless night in your mind, can only see the benefit. You are learning, you are growing, you are becoming a better doctor, but you will always carry the memory of that night with you, the memory of the grave and the memory of the man you stole. You walk home in the fading light, the smell of formaldehyde still clinging to your clothes. You are a different man than you were yesterday. You have crossed a line between law and crime, between light and shadow. But you have also taken a step closer to your goal. You are becoming a doctor. You go to bed, your mind filled with images of arteries and veins, and you pray that the ghosts of the cemetery will not haunt your dreams. The cold clinical world of the anatomy theater gives way to a place of a different kind of dread. The air is no longer thick with the smell of death, but with a palpable sense of despair. You're no longer a doctor or a student. You're a visitor, a witness to the dark and terrifying world of 18th century mental health. You are standing outside the gates of Bethlehem Royal Hospital, known more commonly as Bedlam. It is a name that has become synonymous with chaos and madness, and you are about to see why. The year is 1770, and the understanding of mental illness is almost non-existent. It's believed to be caused by a variety of things, from an imbalance of humors to moral failings to possession by evil spirits. The treatments are as varied as the diagnoses, and almost all of them are brutal. You pay a small fee to enter a little-known fact that the public was allowed to visit Bedlam for a small fee, treating the inmates like a zoo attraction. It's a horrifying spectacle. You walk down a long corridor, and the sounds of the hospital assault your ears, a mixture of screams, sobs, and incoherent muttering. The inmates are housed in cells, sometimes naked, sometimes chained to the walls. The conditions are appalling. The air is stagnant and foul, and the sanitation is non-existent. You see a man in a corner, rocking back and forth, a vacant look in his eyes. You see a woman screaming at the top of her lungs, convinced she is a queen. The staff, or keepers, as they are called, are not trained medical professionals. They are often former inmates or people who couldn't find work anywhere else. Their job is to keep the inmates from harming themselves or others, and they do it with brute force. You see a keeper applying a treatment to a patient, a man who is prone to violent fits. The treatment is called the bath of surprise. The patient is lowered into a deep well of cold water and then with a rope is plunged unexpectedly beneath the surface. The theory is that the shock of the cold water will shock the madness out of the patient. This is a common historical fact, the belief in shock therapy, even in its most crude and barbaric form. It is a terrifying sight. The man thrashes and screams, his body fighting against the cold and the fear. The keeper pulls him out shivering and gasping for air and then a moment later plunges him back in. The cycle repeats again and again until the man is too weak to resist. The treatment is not a cure. It is a punishment. It is a way of breaking the patient's spirit, of forcing them into submission. You move on and see another patient, a woman who is depressed and withdrawn. The treatment for her is the gyrating chair. She is strapped into a chair that spins at a high speed. The theory is that the spinning will cause a rush of blood to the brain, which will in turn correct the patient's thoughts and emotions. This is a bizarre and little-known detail of 18th century mental health treatment. The woman is terrified, and as the chair spins faster and faster, she begins to vomit. She is not cured. She is simply traumatized. The treatment, like so many others, is a testament to the profound ignorance of the human mind. The keepers believe they are helping, but they are only inflicting more pain and suffering. You are watching these horrors unfold, and you can't help but feel a sense of profound pity and disgust. The people in this place are not criminals. They are sick. But they are being treated like animals, like curiosities. You see a man who has been placed in a restraint chair, his body completely immobilized. He is being force-fed a concoction of herbs and minerals, a purge designed to cleanse his system of the bad humors that are believed to be causing his madness. He fights against the restraints, his eyes wild with terror. But there is no escape. This is his life now. A life of pain, isolation, and brutality. This is a good example of an academic debate that historians still argue about. Were these treatments, however brutal, a genuine attempt at helping the mentally ill? Or were they simply a form of social control, a way of getting a difficult, unwanted population out of sight and out of mind? It's a question that you, a man walking through this nightmare, can only ponder with a shudder. You leave the hospital, the sounds of the screaming fading behind you, but the images of the suffering will stay with you forever. You walk back into the bustling streets of the city, the sights and sounds of normal life, a jarring contrast to the horrors you just witnessed. The people around you, oblivious to the suffering just a few blocks away, go about their daily lives. You are a different man now, a man who has seen the dark underbelly of humanity, the place where science and compassion have not yet penetrated. You go to bed, your mind filled with the faces of the inmates of Bedlam, and you pray that one day there will be a better way. The screams and sobs of Bedlam are replaced by the soft glow of a fireplace and the intimate, tense atmosphere of a home. You're still a medical professional, but your role has shifted once again. You are now a midwife, a woman who is about to help another woman bring new life into the world. The year is 1790, and you are in a small, cramped bedroom, the air thick with the smell of wood smoke and a palpable sense of fear. The patient is a young woman no older than 20, and this is her first childbirth. Her husband, a farmer, paces nervously in the hallway, his face a mask of worry. This is a common historical fact. Childbirth was a terrifying ordeal, a leading cause of death for women of all social classes. The mortality rates for both mother and infant were staggeringly high. You have been with her for hours, and the labor is not progressing. Her contractions are weak and irregular, and she is growing tired. You are a midwife, a practitioner of a profession that has been around for centuries, passed down from woman to woman. You have no formal medical training, but you have years of experience. You know the rhythms of the body, the signs of a healthy birth, and the warning signs of danger. But today, the danger is palpable. You are worried about her. You are worried about the baby. This is a little-known fact that while male doctors were beginning to enter the field of obstetrics, the majority of births were still attended by midwives, a stark contrast to the modern world, where male doctors are the norm. The young woman is in agony. She cries out with every contraction, her body shaking with the effort. You try to soothe her to calm her fears. You give her a small glass of wine to dull the pain, but it does little to help. You know that if the labor doesn't progress, the baby could be in danger. It could become breech, or it could get stuck in the birth canal. You have a few tools at your disposal, but they are all terrifyingly crude. You have a pair of forceps, a metal instrument that looks more like a pair of tongs than a surgical tool. They are a recent invention, and they are controversial. Many midwives believe they are a dangerous and unnatural intervention, but you know that in a difficult birth, they can be a lifesaver. You also have a crochet, a sharp-hooked instrument used to dismember a dead fetus in the womb to save the mother's life. It is a gruesome and desperate measure, a choice no one ever wants to make. You decide to call for help. You send the husband to fetch the local doctor, a man who is a surgeon apothecary. He is not trained in childbirth, but he has the tools of the trade. He arrives an hour later, a gruff, impatient man with blood on his coat. He examines the woman and declares that the baby is stuck. He takes out his forceps and with a terrible grinding sound, he begins to pull. The woman's screams are a high-pitched shriek of pure terror and pain. You are horrified. The doctor is pulling with all his might, and you are afraid he is going to tear her apart. You try to tell him to be gentle, but he ignores you. He is a man of science, and he believes that brute force is the only way. He finally succeeds, and the baby is born. But it is stillborn, and the mother is bleeding profusely. She will likely not survive. The doctor shrugs, takes his payment, and leaves. You are left alone with the grieving father and the dying mother. You are a midwife, a healer, but you are helpless. You can only watch as a life ebbs away. This is a good example of an academic debate that historians still argue about. Did the introduction of male doctors and their surgical tools, such as forceps, ultimately benefit women? Or did it increase the dangers of childbirth? The mortality rates for women in hospitals were often higher than at home with a midwife. The question is a difficult one, a question that you, a woman who has just seen a tragedy unfold, have no answer for. You walk home in the gray light of dawn, the weight of the tragedy heavy on your shoulders. You are a midwife, a woman who brings life into the world, but you have just witnessed death. You go to bed, your mind filled with the image of a stillborn child and the sound of a woman's last breath, and you pray that tomorrow the scales will tip in favor of life. The intimate, tragic world of childbirth gives way to the vast, indifferent expanse of the ocean. You're no longer a midwife. You're a sailor, a man on a wooden ship in the middle of the Atlantic. The year is 1740, and you are on a long voyage, a journey that has already lasted for months. The air is salty and damp, and the only sound is the creaking of the ship's timbers and the endless rush of the waves. But there is a silent, invisible enemy on board, a disease that is more terrifying than any storm. It is a common historical fact that scurvy was the scourge of the seas, a disease that killed more sailors than storms, shipwrecks, and battles combined. You have been at sea for so long that you have forgotten the taste of fresh fruit and vegetables. Your diet consists of hardtack, a kind of dry, hard biscuit, and salted meat. This is a diet that is almost completely devoid of vitamin C, a vitamin that is essential for life. But you, a man of the 18th century, don't know about vitamins. You believe that scurvy is caused by a variety of things, from the cold, damp air of the sea to idleness and a lazy blood. You have seen the signs of the disease on your shipmates. Their gums are swollen and bleeding, their teeth are loose, and their skin is covered in bruises. They are weak and tired, and they complain of joint pain. The disease is a slow, agonizing process, a gradual decay of the body. You have a sick bay on board a small, dark, and airless room below deck. It is a place of misery and despair. The ship's surgeon, a man who is little more than a barber surgeon, with a compass, has a variety of remedies at his disposal, but none of them work. He tries to cure the men with a concoction of herbs and spices, believing that the disease is a result of a cold humor that needs to be warmed. This is a little-known detail, the strange, almost comical beliefs about a disease that was killing thousands of men. He gives them a mixture of molasses and tar, a foul-tasting remedy that does nothing to stop the progression of the disease. He gives them a drink made of vinegar and water, believing that the acidity will cut the disease out of their system. It is all a futile effort. The men continue to sicken and die. You see a shipmate, a young man who was full of life and laughter at the beginning of the voyage, now a shadow of his former self. His face is pale and sallow, and his eyes are sunken. He has lost his teeth, and his gums are a bloody, festering mess. He is too weak to work, and he spends his days lying in his hammock, staring at the ceiling. You try to cheer him up, to talk to him about home, but he is too far gone. He is a man who has been condemned to death by a lack of a single simple nutrient. This is a good example of an academic debate that historians still argue about. Why did it take so long for the cure for scurvy to be widely adopted? James Lind, a Scottish naval surgeon, discovered in 1747 that citrus fruits could cure the disease. But it took decades for the Royal Navy to mandate that its sailors be given lemons and limes. Was it a matter of cost logistics, or a simple reluctance to change old habits? The ship finally reaches port, and you, a man who has been living with the constant threat of scurvy, are overjoyed. You and your shipmates rush ashore, and the first thing you do is find a market. You buy an armful of fresh fruit and vegetables, and you eat them with a kind of desperate hunger. You feel the life returning to your body, the weakness and the pain slowly ebbing away. You are a man who has been to the brink of death and back, and you know that you are one of the lucky ones. You go to bed, your mind filled with the faces of the men you lost to the sea and to the disease, and you pray that one day sailors will no longer have to suffer and die from a disease that can be cured with a simple orange. The vast open sea and the ravages of scurvy are now behind you. The world has shrunk back to the cramped, odoriferous streets of the city, and your role has changed once more. You are no longer a sailor, you are a patron, a man in search of a cure for a persistent ailment. Your destination is the apothecary, a place that to your modern eyes would look like a combination of a pharmacy, a herbalist's shop, and a curiosity cabinet. The air inside is a bewildering mix of smells, dried herbs, spices, alcohol, and the sickly sweet scent of exotic concoctions. The year is 1760, and the apothecary is a central figure in the medical landscape, a man who dispenses remedies for everything from a simple cough to the most dreaded diseases. This is a common historical fact. The apothecary was the source of most medical treatments for the average person, a man who was both a dispenser of medicine and a purveyor of often dangerous remedies. You have a terrible headache, a pounding, relentless pain that has been with you for days. You believe it is caused by a fever, a hot humor that needs to be cooled down. You approach the apothecary, a man with a stern face and a meticulous manner. He listens to your symptoms, nodding sagely, and then begins to prepare a remedy. He takes a small amount of laudanum, a powerful tincture of opium, and mixes it with a pinch of powdered mercury. The laudanum is a common and effective painkiller, but the mercury is a deadly poison. This is a terrifying and little-known detail of 18th century medicine. Mercury was believed to have a variety of medicinal properties, from curing syphilis to treating skin diseases. The apothecary believes that the mercury will purge your system of the bad humors, and the laudanum will dull the pain. He sells you the concoction, a small bottle of dark liquid, and you leave trusting that he has your best interests at heart. You have a choice: take the concoction and risk poisoning, or endure the pain. You choose the former. You also see other customers in the shop, each with their own ailment and their own hope for a cure. A woman is buying a bottle of Dr. Anderson's Scots pills, a popular patent medicine that was advertised as a cure for a variety of ills. It was in fact a powerful laxative, a combination of aloes, jalap, and gamboge. It would purge the body of its contents, a violent and unpleasant experience that was believed to be a sign that the medicine was working. This is a good example of an academic debate that historians still argue about. Were these patent medicines, with their outrageous claims and often dangerous ingredients, a form of exploitation? Or were they a necessary source of comfort and hope in a world without effective medicine? The answer is probably a mixture of both. They were certainly a way for enterprising men to make a fortune, but they also offered a sense of control and hope to people who had very little of either. You see a man buying a small vial of arsenic, a deadly poison for a family member who has been diagnosed with a fever. The apothecary explains that in small doses, the arsenic can be a powerful tonic, a way of purifying the blood. This is another terrifying detail of 18th century medicine. The line between a poison and a medicine was so thin as to be non-existent. You are a patron, a consumer in this world of dangerous remedies, and you are trusting a man who is, by our modern standards, a charlatan. But in this world, he is a healer, a man of science, a man who is trying to do his best with the tools at his disposal. You walk home with your bottle of mercury and laudanum, the dark liquid sloshing ominously. You have no doubt that it will either cure you or kill you. You are a man in a world of high stakes, a world where the search for a cure is a gamble with your life. You go to bed, your mind filled with the strange and terrifying concoctions of the apothecary, and you pray that the remedy you bought will not be the one that ends your life. The dark, murky world of the apothecary's poisons and purges is now in the rearview mirror. A new day dawns, and with it a faint, almost unbelievable glimmer of hope. Your role has shifted to that of an observer, a witness to a moment of medical history that will change everything. You are standing in the English countryside, a place of green fields and quiet villages a world away from the chaos of the city. The year is 1796, and you are about to see the birth of a revolutionary idea. This is a common historical fact. The story of vaccination begins not in a grand hospital, but in the small, humble world of a country doctor named Edward Jenner. Jenner is a man with a curious mind, a man who has been observing the world around him with a keen eye. He has noticed a peculiar thing. Milkmaids, women who milked cows, rarely contracted smallpox, a deadly and disfiguring disease that was a constant threat to the population. He noticed that they often contracted a milder disease, cowpox, a relatively harmless illness that caused sores on their hands. He theorized that the cowpox in some way protected them from the smallpox. This is a fascinating and little-known detail, the simple observation that led to one of the greatest medical breakthroughs in history. You are watching as Jenner prepares to test his theory. He has found a young boy, an 8-year-old named James Phipps. The boy is healthy and has never had smallpox. Jenner takes a small amount of pus from a cowpox sore on a milkmaid's hand and, with a small knife, makes 2 shallow cuts on the boy's arm. He then inoculates the boy with the pus, a horrifyingly crude procedure by today's standards. The boy develops a mild fever and a small sore on his arm, and then after a few days he is completely fine. The experiment has been a success. The boy has been vaccinated, a term that Jenner would coin from the Latin word for cow vacca, but the experiment is not over. Jenner must now prove that the vaccination has worked. He must expose the boy to smallpox, a terrifying and dangerous step. You are watching with bated breath, your heart in your throat. Jenner takes some pus from a smallpox patient and inoculates the boy again. The boy miraculously shows no signs of the disease. The vaccination has worked. The boy is immune. It is a moment of pure triumph, a moment that will change the course of human history. This is a good example of an academic debate that historians still argue about. Was Jenner's experiment ethical? He was, by today's standards, experimenting on a human child without his consent. It's a difficult question, a question that you, a witness to this miracle, can only ponder with a mixture of awe and unease. The news of Jenner's discovery spreads slowly at first with skepticism and disbelief. But as more and more people are vaccinated, and as the smallpox rates begin to fall, the idea takes hold. It is a slow, difficult process, but the world is changing. The age of miasmas and humors is slowly giving way to the age of science and immunology. You are a man who has seen the horrors of the 18th century, the amputations, the quackery, the terrifying diseases. And now you have seen the beginning of the end of that world. You go to bed, your mind filled with the image of a small boy with a small scar on his arm, and you pray that this new age of hope will be a lasting one. The small, hopeful scar on a boy's arm has now faded, and so has the 18th century. You are no longer an observer in a specific time. You are a traveler, a man who has witnessed the entire horrifying journey of medicine's past. The smells of the miasmas, the screams of the operating theater, the desperation of the apothecary's shop, they are all just memories now faint and distant, echoes in the long corridors of time. You've seen the brutality, the ignorance, and the superstition that defined an era. But you have also seen the small, brave acts of courage, the flashes of genius, and the relentless human desire to heal and to understand. This is a common historical fact. The progress of medicine was not a straight line, but a chaotic, often bloody path full of dead ends and false starts. You look around you now in this new world. You see the clean, sterile rooms of a modern hospital. You see a surgeon, his hands covered in latex gloves, a mask over his face, performing an operation with a precision and a level of care that would have been unimaginable to the barber surgeon of old. The patient is asleep, a gentle hum of machinery around them. The surgery is not a spectacle of pain and gore, but a quiet, methodical process of healing. You've come a long way from the dental key and the bone saw. Remember that pigeon dung poultice for gout. Now a doctor can prescribe a simple medication to manage the condition. The pain and the indignity are gone, replaced by a simple, effective treatment. It's a little-known fact that the development of anesthesia, first with ether and later with other chemicals, was a direct result of the terrifying pain of 18th century surgery. The horror was the mother of invention. You think back to the poor inmates of Bedlam, their minds shattered, and their bodies abused. You contrast that with a modern mental health facility, a place of therapy, medication, and compassion. The gyrating chair and the bath of surprise are long gone, replaced by a new understanding of the human mind. The debate about whether the brutal treatments were a necessary evil or a form of social control has been settled. They were a crime against humanity, and we are better for having left them behind. The story of medicine is not just a story of scientific progress. It is a story of a slow, difficult, and often painful evolution of compassion. You remember the countless sailors who died of scurvy, their bodies wasting away on the long voyages. You remember the men who died of infection after a simple amputation. You remember the mothers and infants who died in childbirth, the victims of ignorance and fear. You think about the world you live in now, a world where scurvy is a rarity, where an amputation is a life-saving procedure, and where childbirth is for most a safe and beautiful experience. The terrifying specter of disease is still with us, but it is no longer an invisible, all-powerful enemy. We have weapons against it now, antibiotics, vaccines, and a deep understanding of how our bodies work. You are a man who has seen a ghost. You have seen the bloody, brutal past of medicine, and you have come out of it with a new appreciation for the world you live in. You are a different person now, a person who doesn't take a simple doctor's visit for granted. You know what it took to get here, the pain, the suffering, and the sacrifice? You know that the men and women of the past with their strange masks and their brutal tools were not monsters. They were simply people doing the best they could with what they had in a world of profound ignorance and fear. Now, as the final shadows of the 18th century fade from your mind, you can finally relax. The air is clean, the world is quiet, and the ghosts of the past are at peace. The long, terrifying journey is over. It's time to dim the lights. Maybe turn on that fan for a soft hum and let the gentle current of sleep carry you away. The past is a dark and bloody place, but it is a place that we can now look back on with a sense of gratitude and a quiet understanding. Good night.